Hi, everyone. I'm Dr. Veda Giri, an associate professor in medical oncology, cancer biology, and urology at Sidney Kimmel Cancer Center at Thomas Jefferson University. I'm also the director of the Cancer Risk Assessment and Clinical Cancer Genetics program at Jefferson. I'm a medical oncologist by training with specialty training in clinical cancer genetics. And I lead an integrated and comprehensive effort in inherited cancer risk assessment and conduct studies focused on genetic evaluation and cancer risk and genetic counseling, specifically in inherited cancers, and in my particular research focus in inherited prostate cancer. I started the first men's genetic risk clinic in the United States in 2014, which was focused on genetic evaluation of inherited prostate cancer in the setting of multidisciplinary care. And this was a team effort because this was done in conjunction with the multidisciplinary team, which includes the medical oncologists, the radiation oncologists, and the urologists, all working with our genetics program to bring top-level care to our patients with prostate cancer and to integrate genetic testing into that process. I also co-chaired the 2017 and 2019 Philadelphia Prostate Cancer Consensus Conferences that have addressed the development of comprehensive frameworks for genetic evaluation and genetic testing, particularly to implement genetic testing and disseminate this technology to populations. Again, this was an international effort that was led by Sidney Kimmel Cancer Center at Jefferson and involved experts from around the globe to come together and develop these evaluation models. I'm also the principal investigator of multiple prostate cancer genetic evaluation studies, which span studies of genetic counseling, genetic testing, disparities, behavioral research, and implementation research. And this is particularly important in the field of prostate cancer, given that this is a male-focused cancer. And there's a lot to be done here with a lot of gaps in our knowledge to be able to really optimize genetic counseling and genetic testing for men. As I mentioned, my research focus is in developing the field of genetic testing and genetic counseling for prostate cancer. And this field is important in the quest for hopefully finding a cure for prostate cancer. Genetic testing is now central to prostate cancer care. It's increasingly driving prostate cancer treatment, management, and screening. Furthermore, in addition to informing treatment, genetic testing can help identify hereditary cancer risk in families and can therefore inform ways to detect, screen, or treat prostate cancer in these families, but also other cancers that are linked with prostate cancer, therefore having an impact for males and females in these families. And our team has been leading the effort to expand genetic testing guidelines, address practice gaps, and provide strategies to implement genetic testing across populations. There really have been some exciting advances and breakthroughs regarding genetic testing for prostate cancer and in precision medicine. In 2020, so earlier this year, the US FDA approved 2 PARP inhibitors, olaparib and rucaparib, as treatment options for men with metastatic castration-resistant prostate cancer who have progressed on initial lines of therapy and who have mutations in specific genes such as BRCA1, BRCA2, and other DNA repair genes. Therefore, these men who have metastatic prostate cancer now have new therapeutic options available to them based on their genetic information. And this helps to determine their candidacy for PARP inhibitors. There are also exciting advances in terms of testing capabilities in the genetic testing space. mRNA testing, which is a kind of technology that looks at what genes are coding for, is now a novel approach that is being conducted to see if certain mutations are actually active in prostate or other cancers. And so these advances are being studied and implemented in our cancer genetics program, as well as in our research efforts. At Jefferson, we've really been on the cutting edge in terms of delivering standard of care and beyond standard of care in terms of genetic counseling and genetic testing for our patients. Jefferson was really well positioned to handle the COVID-19 pandemic due to its investment in telehealth technology. Our genetics program was able to pivot rapidly to offer telehealth, web-based video consultations to our patients in order to keep offering state-of-the-art genetic counseling and genetic testing. Jefferson also has a huge footprint in the Delaware Valley with many diverse populations that need attention regarding genetic testing for prostate cancer in order to have not only just equality of care, but equity of care in order to be able to offer precision medicine to all of the patients that we are here to serve. So I think that the Philadelphia Prostate Cancer Biome Project is really pivotal in terms of contributing to making advances in this field. The PPCVP is crucial to having ongoing advances. We are actually currently planning further research studies that focus on genetic mutations and genetic testing in African American men with prostate cancer. This is a vastly understudied population and is really important to study because we know that African Americans have an inordinate burden of prostate cancer, and also there needs to be these conditions and situations addressed for African American men and their families. So we plan to expand our work into genetic testing for African Americans. We want to address disparities and reduce the burden of prostate cancer and other cancers linked in these families. Some of these other cancers that are linked are very common cancers and can be deadly. So for example, breast cancer, ovarian cancer, pancreatic cancer, and colon cancer. This becomes very important for prostate cancer survivors to be proactive with, but also for families of prostate cancer patients. We are also working to build technology-based options to expand access to genetic counseling and genetic testing, especially highly relevant during this pandemic. Therefore, philanthropy is really crucial to our work. The genetics program is in a critical need for additional staff and team members to help address patient navigation through our healthcare system, particularly relevant to genetic counseling and genetic testing. For example, our intake staff are dedicated to our genetics program. They field all calls coming into our program. They perform an intake of family cancer history, help to talk patients through the initial steps of genetic counseling, make appointments for our patients, and help them set up the telehealth platforms. So our intake staff are crucial, and we're in critical need of expanded intake staff to be able to address our catchment area and the patients in our areas. Our research focused on African American men will be dependent on philanthropy to be able to begin and proceed to successful outcomes. And all telehealth-based and technology-based solutions planned will require philanthropy for development, implementation, and testing. And of course, this is critical for access to care in terms of genetic counseling and testing. So really, in summary, I just wanted to say that there are exciting advances that are being made regarding genetic testing for prostate cancer, diagnosis of prostate cancer, and precision treatment of prostate cancer. And genetic testing is now central to all of those aspects of care, and we really need to be continuing to be on the forefront to expand this field, to be able to offer genetic testing to all of our patients, to diverse populations, and expand our knowledge of this field. Thank you for joining me today. We are really grateful to be able to bring this symposium to you, to keep you informed on our progress. And progress is really only made possible by philanthropy that supports the importance of our research being done and to help improve the lives of cancer patients today and tomorrow. Thank you.